Hello and welcome to another edition of Health Matters. My name is Dr. Michael Chillemi, and in today's episode, we're going to discuss psoriatic arthritis, understanding it. We're going to dive deep into the depths of psoriatic arthritis, which is a chronic autoimmune form of arthritis that not only affects joints, but it also comes with complexities such as psoriasis. We're going to cover symptoms in granular detail, causes, diagnosis, non-invasive treatment methods, medical treatment methods. So with that said, let's get into it. What is psoriatic arthritis? So psoriatic arthritis is a chronic inflammatory disease that affects up to, or right around, 30% of people that have psoriasis. Psoriasis is a condition marked by red patches, usually covered with silver type, scaly type skin. While psoriasis often precedes psoriatic arthritis, the later can manifest before or simultaneously at the same time with skin symptoms. So the primary characteristic of psoriatic arthritis includes joint pain, joint stiffness, and swelling, which can affect a variety of different parts, including fingertips, the spine. If it's in the spine, it could be called spondyloarthritis when it affects the spine. The severity of the symptoms can often vary, and they can fluctuate between flare-ups and periods of remission because there is no cure, right? There's no cure for psoriatic arthritis. Effective management is crucial for managing and maintaining a quality of life. Both psoriatic arthritis and psoriasis are progressive conditions which can worsen over time. Symptoms tend to mimic those also of rheumatoid arthritis, like the painful swollen joints, the warm, hot, swollen joints. So with that said, let's explore the specific symptoms and details of psoriatic arthritis. So in detail, breaking down the psoriatic arthritis, there are several distinct symptoms which may vary in intensity from person to person, but let's break these down for a comprehensive understanding. Joint pain, joint stiffness, and swelling. Entheses, nail changes, fatigue, and skin symptoms. Those are all the different types of symptoms that we're going to talk about for rheumatoid arthritis. But let's kind of jump into each one of them and have a better understanding of it. So the first symptom we're going to really talk about with this is going to be joint pain. The primary symptom of many joint disorders is joint pain, which can affect one or more of the joints. It's commonly experienced in areas such as the fingers, toes, and knees, and back. The discomfort is primarily due to the inflammation of the joints. Next, we're going to talk about joint stiffness, right? So joint stiffness is often worse after periods of inactivity, such as when waking up in the morning. The stiffness can last more than 30 minutes, making movement challenging at times, right? Joint and spine symptoms can vary, and sometimes they can change a little bit, right? So when you look at like peripheral arthritis that affects the joints of the fingers of the nail beds, and they can typically affect the wrist, ankles, and knees, leading to pain and tenderness and those warm, swollen joints. Another condition that we're going to look at is dactitis, which is the cause of severe swelling in the fingers and toes, making them very hard to bend. Sometimes they can give you the appearance of sausage-like. And that's the term sausage-like fingers comes from this. Spondylitis. Here, pain and stiffness occurs in the spine, the lower back, the neck, and the hips. Another symptom we're going to talk about is enthesis, which involves inflammation where a tendon or a ligament attaches to the bone, which that is called the enthesis. There are two primary types: fibrous, where tendon or ligament directly connects to the bone, or fibrocartilaginous, which involves a complex transition from various tissue. Common areas that are affected are the heels, leading to Achilles tendonitis, and the bottom of the feet, causing pain or when you walk or stand. This condition is typically due to overuse or an injury, or an underlying disease leading to these type of symptoms. Enthesis is closely associated with spondyloarthropathies, a group of inflammatory rheumatic diseases causing arthritis. The inflammation at the enthesis can be particularly painful, especially when the symptoms change. One of the symptoms changes that is identifiable for psoriatic arthritis is nail bed changes. There could be a variety of different types of changes in the nail bed, from pitting to small depressions to thickening and discoloring. And in severe cases, the nails actually can come off from the bed. Ouch, that would hurt. And sometimes the nail beds could become brittle with white spots. Another symptom for psoriatic arthritis is fatigue. Many people with this disorder experience severe and persistent fatigue that doesn't improve with rest. This overwhelming tiredness sometimes comes with a low-grade fever and fluctuates with periods of flare-ups. Another symptom that we're going to talk about with psoriatic arthritis is skin symptoms. Psoriasis, right? That's the most common symptom with psoriatic arthritis. It can manifest as itchy, painful, or red patches. It could be silver, scaly, or dead-like skin cells. Often appears on the knees, elbows, and scalp. These patches can significantly affect the quality of a patient's life. Another thing that we're going to want to look at is foot and lower back pain at the attachment point of the tendons. They could, especially at the Achilles, they could be very, very painful. And you really want to pay attention to them, because that could really, really cause significant discomfort from patients. Another condition or symptom that can be affected with psoriatic arthritis is eye inflammation. Conditions like uveitis can cause redness, pain, and blurry vision, potentially leading to vision loss if untreated. We're going to summarize some of these feelings of the symptoms of psoriatic arthritis. So, even though the symptoms could widely change between different people, one of the telltale signs is going to be joint pain and swelling in the fingers, toes, knees, and ankles, and lower back. Morning stiffness that worsens after a period of inactivity. Red, scaly type skin lesions, typically elbow, knees, and scalp. Nail changes, fingers, including pitting, discoloration, and separation of the nail bed. Eye inflammation, uveitis or conjunctivitis could be what we talk about, and generalized fatigue and lack of energy. So that's going to wrap up the comprehensive look at joint-related symptoms for psoriatic arthritis. Keep in mind, these insights are personal to each person. Whether you're getting this information for you or somebody else, supporting people that have this type of condition is important. It's important to know that they have support, because this could be a challenging time in somebody's life. You really want to be supportive. Okay, let's look at the next part, which is going to be the types of psoriatic arthritis. So the first type that we're going to look at is systemic psoriatic arthritis. So systemic psoriatic arthritis can affect both sides of the body, and it could mirror each side. And it could be a similar pattern to actually rheumatoid arthritis. And it could be affecting typically more than one joint, right? So it's going to affect multiple joints. So it could affect the wrist and hands and the knees. Due to the symmetry within the body and the systemic parts of the body, it can affect multiple areas in bilateral aspects of it. The next area that we're going to look at is asymmetrical psoriatic arthritis. So with this condition, it does not affect the same joints on both sides of the body, meaning it can impact a joint on one side while leaving the corresponding joint on the other. So it could affect my wrist on my right hand, but my left wrist might be okay. My right knee might be bad, my left knee might be good. This type is generally milder than the systemic and usually involves less joints. The most common areas affected are the fingers and toes, that you have that sausage-like fingers. But if you do get it, it could be significant because your ability to bend, remember, you can't bend, that's going to definitely affect your life. The next one we're going to talk about is called distal interpharyngeal predominant. It's called DIP, psoriatic arthritis. So the distal interpharyngeal predominant, aka DIP, psoriatic arthritis, primarily affect the small joints of the fingers and toes. So your distal interphalangeal joints, blah. So distal means the furthest away from the body, right? So that's the distal part. This type is often mistaken for osteoarthritis because of its location in the fingertips. And thickening and discoloring of the nails are one of the bigger symptoms that you're going to look for to differentiate between OA and psoriatic arthritis. So affecting these small joints can make fine motor skills like writing or buttoning a shirt very difficult. Next type of psoriatic arthritis we're going to look at is spondylitis psoriatic arthritis. So this typically involves inflammation of the spine and the sacroiliac joints. So the joints connecting the lower spine to the pelvis, that's called the SI joints, the sacroiliac joints. And they can have pain and stiffness. And it could be affecting, you can go to the neck, the lower back, and the pelvic region. This type of psoriatic arthritis can lead to significant reduction in motion and flexibility and movement, making it hard to bend, to twist, to lift. There are times when this could even be associated with fusion of the spine because of your flexibility hasn't changed, right? So if you don't move it, you lose it. And one of those symptoms could be actually affecting that. The next one we're going to talk about, it's a little less common, but it is part of it, is arthritis mutilans. And this is a severe form of psoriatic arthritis. Even though it's rare, it does cause a significant joint damage. It can lead to severe disability due to the destruction of bones and cartilage, resulting in telescoping of the fingers and toes, where the bones become shortened and the digits appear to be pulled inward. Patients with this type of condition are in extreme amounts of pain, and their daily function is severely impacted. Understanding the different types of psoriatic arthritis is essential for identifying the most appropriate treatment strategies and management. Okay, now let's get into what are the causes? How do you get psoriasis? How does it happen? So let's dive into it. When you dive into it, the causes of psoriatic arthritis, which is an autoimmune disease where your immune system inadvertently attacks its own body tissue. The exact cause remains unknown. So there are a couple of thoughts out there of what it could possibly be. So one of the thoughts is it's a combination of some genes and immune changes and environmental factors. Let's break it down a little bit further. First, when we talk about genetics, a predisposition like a family history plays a significant role. Many individuals with psoriatic arthritis have relatives with psoriatic arthritis or psoriasis, one or the other. Certain genes can be linked to blood tests like HLA-B27, which have been shown to increase in psoriatic arthritis. Next, if we look at the immune system dysfunction, as an autoimmune condition, psoriatic arthritis arises when the body's immune system mistakenly targets healthy joints and skin cells and attacks them. This defective immune response leads to inflammation and overproduction of skin cells, and commonly are seen in this condition. Last potential target is going to be environmental triggers, such as external factors. Sometimes the environment can cause changes in us and make us have exacerbations. And whether you have an infection, some physical trauma, or significant stress, those can be some key triggers. Additionally, lifestyle factors like obesity and smoking can play a role in the onset of symptoms. So to sum it up, psoriatic arthritis, the development of it is a complex interplay of genetic factors, immune system, and dysregulation and environmental triggers. Understanding this is crucial for managing your condition. Look, I'm gonna just tell you this. With that said, it's really not saying that much, right? So what I just told you is basically there's no real defining factor to say why you're going to get it. There are thoughts that your genes, your immune system, and the environment around you can cause your body to undergo changes, and therefore, because it's autoimmune, your body doesn't know how to handle it, so it expresses it in a way that it shouldn't, right? You might have a bad gene in there, and then your body's bringing that gene out, but they really don't know. That's the difficult part when you have a condition that you can't pinpoint and say, aha, I got it, I know why. It's very difficult. And I understand that because I see it. I have patients every single day that has psoriatic arthritis, right? So I see it all the time. And I have that whole spectrum that we just talked about, I have those patients. And it is frustrating for them. Because you could have days where they're feeling great, they're functioning well, and other days where it's very difficult. So understanding that and managing it is critical. Let's jump into diagnosing psoriatic arthritis. How do we diagnose it? What do you do? Because the process is quite complex due to the absence of a definitive test. The way we typically want to diagnose somebody with psoriatic arthritis, first, as always, a great medical history, right? You have to get a great medical history. You have to do a great physical exam and really documenting the onset and the severity of your symptoms, really going through your family history, if you have any psoriasis in your family or psoriatic arthritis, and go through the triggers of what started it, what brought it out. Did you have any joint pain or swelling, any changes in your fingernails? Those are kind of going to be some of the things you really want to go through all your different tests. Then you're going to want to look at some blood tests. These tests can be crucial for ruling out other conditions. So you can say, oh, it's not that condition, like specifically rheumatoid arthritis. So if you were looking at it and you were thinking maybe it's rheumatoid arthritis and you ran an RA panel and that was negative, right, then you know it's not going to be rheumatoid arthritis, right? So it's crucial to understanding some of those factors. Other things that you're going to look for is inflammatory markers like C-reactive protein, right? And when you put it all together, those are really important. I mean, it's obviously a lot more involved than that, and I don't think we really need to go into all the details of different blood tests, but basically, you're going to utilize your blood test to rule out other conditions and potentially rule in psoriatic. Because when certain tests are identifiable with conditions, that's one of the ways you're going to want to rule them out. Next, we're going to look at imaging, x-rays, MRIs, ultrasounds. All these different tools can look at bones and joints. And these imaging can reveal characteristics and changes that are indicative of psoriatic arthritis. So typically, when we want to confirm a diagnosis, we're going to want to also consult a rheumatologist, right? So I would want to consult another physician to say, hey, these are the symptoms, this is what it is. I want to send this patient out here. Two doctors usually together will come together and say, yes, but the rheumatologist will be the one to actually make that diagnosis. Seeing a specialist can provide a much more detailed analysis and some more advanced diagnostic tools to pinpoint the diagnosis, right? That's what rheumatologists actually do. It's for a variety of different conditions. So in summary, diagnosing psoriatic arthritis involves a multifaceted approach that goes over history, physical exam, blood test, imaging, and really having a detailed understanding of what you're going through, what your symptoms are, and the changes you had in your life. Next, let's talk about non-invasive treatments for psoriatic arthritis. We're going to explore this in some pretty good detail because you really want to do some practical strategies that can help. Because we already mentioned this, right? There is no cure for psoriatic arthritis, but there are a variety of non-invasive treatments that can help manage. So obviously, one of the big treatments that I'm going to talk about and we're going to spend some time with is chiropractic care, right? So chiropractic care can support and manage the overall treatment of patients with psoriatic arthritis by employing a variety of different treatments, all aimed at alleviating pain, improving joint function, and enhancing overall well-being. So how does a chiropractor actually treat psoriatic arthritis and what are some of the benefits? So first and foremost, obviously, spinal adjustments. When we do our adjustments, we are taking away the pressures in the joints, right? So we're performing our spinal adjustments to correct the misalignments in the vertebrae to improve joint motion, joint function, and alleviate the spinal pressures that are associated with that. Psoriatic arthritis patients typically have symptoms affecting the spine, and adjustments tend to help a great deal in keeping patients' improvement and moving and functioning, especially in the back or neck. Other things that chiropractors can do is joint mobilization. So joint mobilization involves gently moving the affected joints into a pain-free motion. So typically we can utilize more of, it's not an adjustment, it's different. It's more about getting the joint to move and function properly, right? So we're going to want to increase the functionality of that joint, and we're going to put that joint through the motion. Other things that chiropractors can do is soft tissue therapies. So therapies like myofascial release, trigger point therapies, muscle tension therapy release, basically trying to increase the blood flow around the area to make those muscles soften up a little bit. A lot of patients that have psoriatic arthritis have a lot of muscle spasms and tightness around the joints. When you utilize soft tissue therapy, you can alleviate some of those symptoms. Other things that we typically would want to do is we do stretching and strengthening. A lot of times we'll give patients specific home exercises and stretching to do to help increase and improve joint flexibility, joint motion, some strength. Other things that we typically do is ultrasound therapy. So ultrasound therapy uses high frequency sound waves to promote healing and reduce tissue inflammation. By reducing some of this inflammation, you can improve function in that area and help repair it. One of the other cool therapies that we do in our office is cold laser therapy. So cold laser therapy is a low level laser that utilizes light to reduce pain and inflammation. This therapy can stimulate cellular repair and the repair mechanism to promote healing in the affected area. This is actually really cool. So what I like to tell patients when we do cold laser, so cold laser mimics an injury to the body. So when you do a laser, your body thinks you're injured. So when you're injured, your body sends lymphocytes to the area to help flood the area, to help heal it, right? So the cold laser says, oh, okay, I need to send lymphocytes to the area because there must be an injury there. This is what's happening. And once you start that process, your body starts to heal itself, right? So that's what cold laser does. It tricks your body into thinking you have a fresh injury and sends lymphocytes to bring down the inflammation to the area. It's actually really, really cool. Other things that we as chiropractors try to do is offer lifestyle and ergonomic advice, right? So we might talk about different things. It could be nutrition. It could be the way you sit at your desk, in your chair, right? Your ergonomic environment, how you get in and out of the chair, a variety of different tasks to improve your daily function and improve your overall health. Could be also talking about support of your feet and proper posture, how to minimize stress. Some of the pain management type of therapies that we do as chiropractors could be electric stim, like a TENS type unit. We could also use hot and cold packs to help decrease muscle and inflammations. These methods usually provide a temporary relief, right? So the whole goal is when you put it all together, you do a variety of different tasks together. That all together builds up, and you tend to have a better response, right? So better, you're not going to just do one thing. You're going to do a whole bunch of those different things together, and the cumulative effects is you should have a really good response. Okay, what's the next non-invasive therapy? Is going to be physical therapy, of course, right? So physical therapy hand in hand with chiro. Well, they do provide a significant role in management because it's going to look to improve the joint mobility. You're going to want to increase the strength, decrease some of the pain, and really help patients with their functionality. So some of the options of treatment that typically go along with physical therapy are exercise programs, right? They're going to show you how to do specific motions and exercises, gentle stretches and movements to maintain flexibility and reduce stress. Strengthening exercises focus on building muscle and strength around the affected joints and areas. You're going to improve your stability by reducing the load on the joints, right? It could be aerobic exercises like walking, swimming, or cycling to improve some cardiovascular health and weight management. Could be manual therapies that talk about joint mobilization. Again, similar, getting those joints moving, right? So you have to get the joints moving. Soft tissue mobilization. You really got to get into the muscles. So physical therapy and chiropractic do a lot of similar tasks together, and it's all for this the same goal. So real quick, I know I have patients sometimes that talk about we give them exercises and some strengthening exercises. And they're like, I could do this at the gym. Why are you giving me this? This is so basic, and what are we doing? And what I try to tell patients is that what we do in the office, even though it seems kind of a lot less than you could do at the gym, it's all about technique, right? So when you're at the facility doing physical therapy, you're not there to run a marathon, to enter a weightlifting contest. You're there to function better. So the whole purpose of the exercise programs is to get you the proper posture, how to do things in the right method, how to function properly in them, right? And not just do them. It's not as simple as that. If it was simple, then physical therapy wouldn't exist. They would just tell you to go to the gym. Without the proper technique and the proper teaching, you won't understand what to do or how to do it. Even though you might have been in the gym for 20 years, right? So there's different techniques. Listen, the day you can't learn is the day you're going the other way, right? We're always learning. So somebody might give you a tip that you do in therapy that can transform your life for different things, right? You never know what somebody else is going to teach you. And even though some of them might seem simple, that's the point of them, right? It's increasing function. It's doing what it's supposed to do. Just remember that. It's not meant to send you to the marathon, and it's not meant to enter any weightlifting competitions. It's to get you functioning again, right? It's to get you to go for that walk with your kid or your grandkid or your niece or nephew or your child, right? It's to get you to go on that vacation that you want to go because you can't function. It's about getting you to move and live life, right? It's not about the life we live, it's how we live it. That's what it's about. All right, sorry, I digressed. Um, Other things that physical therapy are going to do, similar to chiro, they're going to do stimulation, water therapy, aqua therapy. They might give you some ergonomic support with different devices and some balance training as well. Okay. Next thing that we're going to talk about is occupational therapy, right? So you can do occupational therapy. Similar to physical therapy, they're going to work with different techniques, more for how to do certain tasks, perform daily functions. Could be opening a jar or going from sitting to standing, or utilizing your braces, or utilizing some other equipment or devices, right? Maybe how to button your shirt. That's typically what the occupational therapies are going to do. So let's talk about the next thing I want to talk about is medical. So in medical, what we're going to talk about is utilizing what type of medicines is out there. So the medicines that are out there are going to vary. And you're going to look at some of the non-inflammatory, non-steroidal anti-inflammatory, the NSAIDs, the ibuprofens and the Proxens. Other disease modifying drugs that you're going to look at are DMARDs, so disease modifying anti-rheumatic drugs. That's the kind of the biggest class in there. And those are specifically meant to slow down the progression of it, right? It's trying to make you not get worse and save the joints and tissue from getting to the next level of damage. There is some new classes of medicines out there. They're biologics. So DMARDs, there's a new biological division, and they're more targeted to the immune system. Really not. There are other drugs, other biologic type drugs out there that are meant to block certain inflammatory enzymes. There's some corticosteroids you can take out there. immunosuppressant medications. So there's a lot of different medications out there. And your rheumatologist will determine what is the best course of action for you. All right, so let's break this down. Let's give you an overview and some conclusions about psoriatic arthritis. Okay. So psoriatic arthritis, having psoriasis is the most significant factor for developing psoriatic arthritis, right? So family history of psoriasis or psoriatic arthritis is something you want to pay attention to. Age most commonly appears between people that are 30 to 50. Gender, men and women are usually equal, though sometimes there are certain types that are more gender specific. Living with psoriatic arthritis, the things you're going to want to do is get regular checkups, ongoing monitor by your rheumatologist, and then if you have psoriasis, it would be by your dermatologist. There are support networks out there that can help you deal with this, right? People that are in the same boat that you are. Self-care practices like stress management, proper skin care, and sleep and rest is important. Identifying if you have any joint damages or joint changes. You want to maintain and keep an eye on your weight, right? Remember, obesity could be one of the things that spike up psoriatic arthritis. Any changes in your eyes, uveitis or conjunctivitis, any changes happening in there? Any effect of your pain, your swelling, all of that, keeping you in check, making sure your psychosocial environment is okay. They all could be challenging. So remembering that psoriatic arthritis affects everyone a little bit differently, which means managing it requires a comprehensive approach. Effective management often involves a combination of a lot of different therapies, from chiropractic to physical therapy to occupational therapy to lifestyle modifications, stress management, medications, good sleep hygiene. These are all important strategies that can significantly impact the quality of your life, making your day-to-day life more manageable. So if you know somebody that is struggling with psoriatic arthritis, I encourage you to tell them about different treatment options. Have them go see a healthcare professional so they can get a personalized plan for them. Remember, early diagnosis and lifestyle changes is critical, not for this condition, but for many, many conditions. Remember, it's always important to have open communications with your doctor. Don't keep secrets, right? We never like when we ask you questions and then, oh yeah, I forgot about this. I had this major event, or I had that major event. And those are important things to talk about because those are the things that sometimes we can put it all together. Understanding that managing this condition can be challenging. There are things out there for help. There are ways to manage it, and there are ways that we can help you. So again, whether you're in the area in New Jersey and we can help you at the Health and Spine Wellness Center, we are happy to do it. A lot of those treatments that we mentioned, we offer in our facility. But wherever you are, go see your healthcare professionals. Have them, the key is write down all your symptoms, write down all the things that you were affected, write down when it started. The more information you give, the better experience you'll have. If you know anybody that can benefit from some of this information, please pass it along. The way we grow as a channel is by you, the public, telling others, right? We're all in this game of life together. So if someone I can say can help, if you take one thing I say and, oh yeah, I can do that. Oh yeah, that's important to me because, right? So my goal is to help people, whether I see you in person or you're watching this, the goal is to help you any way I can. So if you listen to one thing and one thing works, I'm happy with that, right? I'm happy that I made you a little bit better, or your sister, your mother, your father, your child. That's what it's about. It's about how do I improve life for others? That's what I typically do. That's what I do every day. And while I can't see all of you, maybe this is a way to help out a little bit for the masses. So, as always, the opinions that you heard here are mine and mine alone. None of this should be construed as medical advice, medical treatment. If you have a condition, please go see the respected professional so they can do a proper evaluation and diagnosis. Please do not be a Google doctor. Go see a true doctor so we can make so they can make a determinations of what is going on. Again, these are my opinions and my opinions alone. So to wrap it up, this is your life, right? It's not about how long your journey is, it's how you are on the journey, right? You could extend life and do different things, but how do you live it? How do you want to function through it? That's the important part, right? But sometimes it's better to get up, get out there, go do it. Because you never know what tomorrow is, right? So don't take today for granted because you never know if no one's promised tomorrow. Take advantage of your time you have. Do everything the best you can. Because at the end of the day, it's your life. You need to be there healthy because your health matters. I'm Dr. Chillemi. You have a great day. Be well.